Hi, everyone. This is Terry Kuti, founder and director of Deep Sea Foundation. I have a very interesting interview today, but before we begin, I would like to tell you a little bit about where the name Deep Sea Journey and Deep Sea Foundation came from, because I do have people ask me that. So in 2014, I had a recurrence of breast cancer. So I'm in the two-timer club, as I often tell people. And I had a very well-informed breast surgeon. She gave me all of my options for breast reconstruction. She told me about implants. She told me about using my own tissue, which is often called autologous breast reconstruction. And she also told me that you could do a combination of the two, often called hybrid breast reconstruction. I chose to have deep flap breast reconstruction, which was using my own tissue. So that's the beginning of the name Deep Sea Journey and Deep Sea Foundation. Deep flap stands for, the letters are DIEP. DIEP is deep inferior epigastric perforators. So that is a subspecialty of plastic surgery. And if you're going to have autologous tissue reconstruction, you need to find a well-qualified microsurgeon to perform this procedure, because the procedure involves taking the skin, the underlying tissue, and the blood vessels of the tummy area or another part of the body, but for deep flap, it is the tummy area. And that skin, tissue, and underlying blood vessels is disconnected, and it's reconnected to the breast area, tying those tiny blood vessels together to give the breast a warm, natural feeling. Thus, a microsurgeon is needed because they tie those blood vessels together. It's called an anastomosis, and they tie those blood vessels together under a very high-powered microscope. So it does take additional skill beyond just plastic surgery training. So you know where the DIEP came from, that part of my foundation and blog name. The C is the first letter of my last name. It's the first initial of my last name, C, Kuti. I put the name Deep Sea Journey together. It blended well for me. It sounded right. So in 2015, I began writing the blog about my experience, and I called it Deep Sea Journey. I also have a podcast on Spotify and other platforms called Deep Sea Journey. A year after I opened my blog in 2015, I opened Deep Sea Foundation. I wanted to be able to provide educational resources for those affected by breast cancer to help them along the entire continuum of their breast reconstruction journey. So that's part of my focus today, interviewing these two lovely ladies that I have on the Deep Sea Foundation video channel. So my guests today are Tammy Hicklin-Estabook and Kristy Matus. Tammy holds a Bachelor of Science in Nursing. She's a registered nurse. She has an MHA from Montana State University. She is the current president of sales at Biodermis. Kristy is the vice president of product management at Biodermis, and she has 15 years of product development experience. Now, Biodermis was the original developer of silicone scar dressing for post-surgical use more than 30 years ago. Since then, Biodermis has launched the industry's most extensive variety of sizes and shapes of silicone dressings. We're going to share a couple of those products here in just a bit, including those that are perfectly shaped for deep flap procedures. Their products are the most widely clinically studied in the scar care market, which is very important for me as an advocate. And our conversation today with Biodermis will show the product's proven effectiveness at achieving the best post-surgical scar outcomes. Before we get started, though, those of you that follow me know that my main priority is empowering you to be your own best advocate along your breast reconstruction journey, and to really continue the greater community to get screened for breast cancer. So Tammy has a very interesting story that she is going to explain to us today why it is so important to get screened. It's a bit of a call to action today. Tammy?
Yeah, Terry, thank you. And thank you for letting me share my story, because screening is so important for each and every one of us, and it does empower us. And 7 years ago, I went in to have my annual mammogram. I have absolutely no healthcare risks or family history of breast cancer, expecting a normal result. And I was given the diagnosis of atypical ductal hyperdysplasia. What does that mean? Kind of like, what is your journey? What does that mean? It puts me at anywhere from a 5 to 20% greater risk of developing breast cancer with age. But because I had that knowledge and I worked with my physician, I then became empowered to be on a medication that reduces my risk of breast cancer, even greater than my risk associated with the disease process. So, I think breast screening or any kind of screening really is so imperative for each and every one of us, because screening is vitally important, not only for detection, but also for treatment. So thank you for letting me share it, Terry.
That is powerful information. And interestingly enough, Tammy, I just had a question about that in my community just today. So I'm not kidding you. This was very timely that you shared that with us. So thank you very much. So I want you guys to know how I found Biodermis, because it was through a deep sea journey surgeon who I trust, and they recommended them. We began a conversation. So from time to time, I get questions sent to me asking what can be done, if anything, to help with scarring after patients have gone through DIEP flap breast reconstruction to restore their breast when they're affected by breast cancer. So through discussions with Biodermis, I have learned that scars are not a one-size-fits-all. And the best product for scar outcomes varies from person to person. So I thought it would be a fantastic opportunity to help educate you. Now, Kristy is going to explain a little bit about how to use or how to choose scar product that's right for you.
Yeah, absolutely. Thank you, Terry. So,
Absolutely.
so scar therapy and scar recovery is different for every single patient, as you mentioned. And so at Biodermis, our customer care team or customer service team collaborates directly with patients and physicians to offer personalized care. So we have a team of people that are just answering phone calls and answering emails, questions about scar therapy. So we take a lot of pride in making sure that there's a lot of support for patients as they go through their post-surgical journey. So that's point number one. We're here to help. But also, just to give you some questions that we typically ask when trying to figure out the best product for an individual. The first question we always ask when trying to get somebody to the right product is, where is the scar located? So if it's underneath clothing, the best possible option is probably going to be scar sheeting that really covers up the scar site and provides a barrier between the scar and clothing. So all of Biodermis's products are 100% silicone based, and it's very premium silicone that's clinically proven, as Terry mentioned. Really the only ingredient actually that's been clinically studied over time for helping to heal scars. It really, what it does is it naturally achieves this perfect balance of letting oxygen flow to the scar site, but also keeping moisture in. And then it also signals the body, and it tells the body, you've sent enough collagen, you've sent enough repair stuff to that site, stop sending it, we're good. that's really what a scar is it's just an abundant buildup of the body trying to keep repairing that site. So the silicone, it does something that tells the receptors in the body that you're good now.
Oh,
And yeah. So silicone
fascinating.
is also, it's very natural. It's hypoallergenic, doesn't have any known allergens in it. It's non-comedogenic, so again, it's breathable. The thing about silicone is that it works best the more often it's used. So the more hours of the day that you can have it on, the quicker you're going to see results. So the silicone sheeting that I mentioned, it can be worn for 12 hours at a time,
Okay.
washed, and then reused.
Oh, so you can wash it and reuse it. I like
Yes.
that option. That's wonderful.
Yes, and not a lot of people know that you can keep using it. So,
Okay.
we have a special wash that you can use, and you just leave it out on your counter, let it dry, and then put it on again. So when it's under your clothing, you can kind of set it and forget it in that way. We have two different options. We have a beige color and then also a clear color. So it really just depends on your preference with that. But I will say the natural fabric kind of slides nicer underneath clothing, especially if you have really tight clothing on in that particular spot. And then for scars on the arms, face, and legs, that's when we typically recommend a product like a gel or our ProCell stick that we have that you can kind of take on the go and keep in your purse and put on whenever you think about it. It's all this goal of trying to make sure that the silicone is on the scar and the scar is protected as many hours of the day as possible.
I'm
But
hearing consistency is important.
yes, consistency is key, exactly.
Yeah.
Yes, and so, but also at night, night is the perfect time to wear a sheet for a long stretch of time. But that's another instance where sheeting is recommended for scar treatment because you don't want the gels to rub off on your bed at night. So again, sheeting is perfect for nighttime.
Okay, so we have options.
Yeah, exactly.
Excellent.
So the next step after that is to determine the shape that's best for you. So this is where I'm going to ask Terry. I believe you have the shapes of some of our products pulled up on our website.
I do. I'm going to do some screen sharing. So let's pull the first one up here. I believe this is the one you are going to talk about.
Yes.
Mhm.
So this one is what we call an areola circle. So if you have a surgical incision around your areola, this product is perfectly pre-cut for that particular area. And then Terry, if you could go to the long strip.
Okay.
As another example.
Let's hop over to this one. Yep.
Thank you. So if you have a horizontal breast incision that goes across your chest, or you have a long abdominal incision that goes across your lower waist line, this is a perfect product to fit across that particular surgical incision.
Excellent.
So yeah, those are just two examples of products that we have, but we have hundreds of SKUs because we have a lot of different shapes and sizes. We try to make sure we have something for every different type of surgery. But the other cool thing is that if you have a scar that's kind of unique and you want to cut the product to shape, we have just full sheets and you can cut the product into any shape that you need it to be in.
Okay. All right. I'm always keen on survivorship. So here's a question for you, Kristy. In addition to your scar treatment, are there any other products that Biodermis has, because I get these questions too, that can help breast cancer patients as they recover and after recovery?
Yes. So we also carry post-surgical foam that reduces bruising and friction and unevenness after fat grafting. So the foam, the only way I can describe it is it feels very much like a memory foam. It's soft, it's buttery, it's comfortable to wear on different parts of your body for an extended period of time. And it evens out pressure if you're wearing compression garments, that sort of thing. And as with all the products at Biodermis, it really relies on silicone technology. But the silicone for this product, it plays a little bit different of a role with the foam. And that's because it's used as an adhesive. So silicone is a natural adhesive. We get that question a lot, like, what adhesive do you put in your product? We don't. Silicone is sticky, but it's such a unique product in that it's sticky, but it also lets go of your skin without taking skin cells with it.
So what you're talking about, Kristy, is phase 2 of DIEP flap surgery or other autologous tissue reconstruction, where the fat grafting is used. So that's the foam that you're talking about, correct?
Yes, exactly. So it helps even everything out and again prevent that bruising. But the silicone, we add it actually to the foam. So we dip that foam into silicone. Nobody else does that for their post-surgical foam. And what that does is it allows the foam to actually hold on to your body while you're putting on your maybe compression garments on top of it or whatever is going on top of it. It keeps it in place. And it also prevents the foam from moving around, shifting, and possibly causing discomfort and shearing. And so that's why we designed it with this silicone on there. And again, nobody else has that on their product. And when you go to remove it, it's not going to hurt.
That's good to know. There's so much manipulation after surgery for patients with their, post-surgical garments and, like you're talking about the scar treatment therapy. So that's good to know. They're going to want to hear this. So thank you so much.
No problem, for sure. And then I did want to add one thing about the going back to the scars, because I've been there when I'm trying to treat a scar and I get a little bit impatient. I want it to work in one day. And so I just want to advise a little bit on the scar recovery and what that looks like typically. So the first thing is, while you still have an incision, before that incision is healed, you don't start scar therapy then. You wait till it's fully healed, till your doctor clears it. But once it's fully healed, that's when you can start applying the scar sheeting or stick or gel on a regular basis. And what we see is for newer scars, you can see improvement in as little as a few weeks with using this product. But it also works on older scars, and that's something that not a lot of people know either, is you can use this on scars from 10 years ago, and you're going to see improvement, but it takes a little bit longer. So it can take 8 weeks to see results. So the main goal of scar therapy is just to blend the scar with the surrounding skin and to flatten it and make it more pliable if it's in a painful area as well. So once you've achieved that, you don't see any more improvement, that's when you stop scar therapy. But I would just encourage patients as you're waiting for it to work. It takes a couple weeks.
So a couple of key things that I heard you say are follow the guidance of your surgeon when you can start your scar therapy, and also be consistent. We know that recovery from surgery takes patience, so there's no reason why you can't take some patience with your scar therapy as well. So I'm really glad that you pointed those two out. So we know that patients in our group have chosen this surgery. Can you tell us where the best place to find your product would be? Where should they go?
So Terry,
Tammy, do you want to take that, Tammy?
Of course. So thank you, Terry. That's a great question, because you can go to your surgeon's office and based on a request, but you can also go directly to our website, which is biodermis.com. I think the thing that differentiates us from everyone is our amazing customer care team. As Kristy just explained, all the different options we have a team of incredible people who take calls daily from patients, just like you're following, Terry, and it will work specifically to better understand what their needs are and what shapes, what sizes, and the configuration, whether it's gels or sheeting, to meet their needs. Because our primary goal is to help you with your scar recovery and to have the best outcomes for every patient. So that's essentially, our website or your physician's office. And please don't hesitate to reach out to our amazing customer care team.
Well, I'm super happy to hear about that customer care support. Additionally, what I'm going to be doing for the listeners is I'm going to be linking your products to the Deep Sea Foundation sponsorship page for our viewers as well. I'm also going to be putting it on the Deep Sea Journey blog under resources, and it will be under recovery products, so you can find it there. So really, I'm glad that I met you both. And I want to thank you both, Tammy and Kristy, for your support of the foundation. And just talking to patients today about this important topic, scar therapy, because we know that in a deep flap recovery, there is just the continuum, and this is such an important part of it. So I really, really appreciate having met you both, and just to be able to look at the Biodermis products. You sent them to me so that I could see them firsthand. I can tell that they're well made, and you guys have cut no corners. So listeners, I've seen them, I've touched them. I just really want to thank you both for supporting the foundation today and for your discussion and this important educational information.
Our
Thank
pleasure,
you.
Terry.
We're honored. Thank you.
All right. Thank you so much.